It was those at Marae to Uru Marai's turn to be heard over the SDHB's Strategic Health Services Plan. The marae hosted a presentation over the document and opened the floor for questions. It's part of DHB efforts to ensure everyone from the cities to rural areas have a say in the future of local healthcare.
And we're coming out on the road to talk to people about the services we provide them with, how they feel about them, how they think we can improve them, and most importantly how we can improve access to services for people that don't live in our major towns.
This is the first time such a plan has been put together by the SDHB, and staff say there are many stakeholders to consider when making it. That includes the Māori community, as well as mental health facilities and rest homes. Staff are gathering as much feedback as possible before public consultation ends on the 21st.
People can feedback online and by filling in the forms at the back of the information brochures we put out in GP surgeries and local libraries, and I'd really encourage people to do that. Once we collate all of that, we'll have another draft of the plan, hopefully a final draft, and we'll take it to our board in February for the board to sign off.
The Strategic Health Services Plan lays out several broad goals for the SDHB. Staff say one of the biggest priorities is building a health system that's more convenient for patients.
If, for example, you go and see your GP in the morning and you have a test and you end up having to be admitted to hospital later in the day, that test doesn't have to be repeated. It's making sure that our providers work together around the needs of the patients in our communities.
Feedback in the consultations has been largely positive, although DHB staff say there's been some tough questions. But that's being welcomed as the Southern District Health Board prepares to take the next step in forming its strategic plan. David Delory in 39 Dunedin News.